Hello, my name's Bruce Keogh. I'm the NHS Medical Director and a cardiac surgeon by background. Over the last decade or so, I've spent quite a bit of time working on data collection and publication of healthcare information both in this country and the United States. And whilst that in its own right is interesting enough, I've, in my current position, also found myself thinking about what are the big drivers for change that are likely to affect not only healthcare in general around the world, but in particular healthcare in our National Health Service. And what impact is that likely to have on our day-to-day lives? It seems to me that there are a series of drivers, 4 drivers in particular, which are going to change the way healthcare is delivered and thought about within our National Health Service. The first of these is going to be economics. Whichever healthcare system you work in at the moment, it's quite clear that economics is going to be a major driver for change. The second set of drivers relate to science and technology, of which information technology, in my view, is the major driver. The third is going to be a set of expectations, political expectations, public expectations, and the expectations of those who deliver healthcare services. And the fourth is going to be the tsunami of changing demographics, which we're all very familiar with. If you think back, the internet hasn't been around that long. The World Wide Web, which gives us such easy access to the internet, is relatively new and is going from strength to strength. What the internet and World Wide Web have offered us, largely through Google and other search engines, is access to information which has previously been privileged, which has been really in the domain of the clinical professional. It's opened that up to a much wider populace. This in turn will change and has changed the behavioral and social dimensions of clinical practice in a way that can't go back and certainly should not go back. It's helped to change the relationship between patients and healthcare professionals from one of a more paternalistic approach to one that's much more a partnership arrangement. Now, that might seem pretty obvious, but I find myself asking what the availability of that sort of information does to the expectations of patients, and in turn what the expectations of patients are going to be in different age groups in our population. So the availability of information across our lives has really changed the way that we behave, and it's changed our expectations of services that we deliver. We're all now our own online bankers, our own travel agents, our own checkout cashiers at supermarkets. And I invite you just to think how long before we become our own navigators of healthcare, and whether the availability of information is going to change healthcare from a primarily delivery business to more of a knowledge exchange. And that's quite a fundamental question. And I think that within the course of a decade, we will see the focus on healthcare shifting to the transfer of information and the sharing of knowledge in a way that we haven't seen so far. You know, the younger generation live off their iPhones and their iPads. They're used to an immediacy of access to whatever it is that they want. They're not going to tolerate sitting around in waiting rooms, reading 3-month-old Sunday Times magazines, being kept waiting. They're going to be looking for online consultations. They're going to be looking for immediacy of access to healthcare information. And when you start to think about that, you start to wonder what that means for the conventional barriers in healthcare. Once you start taking online consultations with healthcare professionals, whether they be doctors, nurses, or other professionals, the geographical boundaries which normally constrain our access to those consultations changes. You don't have to necessarily go to the local hospital or your local general practice. You can get access to that information in another town, in another part of the United Kingdom, and increasingly in other parts of the world. And remember that when it's daytime in England, it's nighttime somewhere else, and vice versa. Architects for a long time have used this sort of difference in time zones to get people to process pictures and diagrams in India where it's daytime, and then the end product can be sent back to England overnight and be ready for the next morning. So with a group of people, a generation that expect immediacy, there will be people on the other side of the world who are prepared to give them advice. You can already find that on the internet. That poses a lot of questions for us, both in terms of how we fund those consultations, given that this is a tax-funded service which is free at the point of delivery. It raises a whole load of questions about how we assure the quality of those sorts of consultations. And it doesn't just stop there. I was in New Zealand a few weeks ago, and someone came up to me and said, I report x-rays for 2 major teaching hospitals in this country, 2 household name hospitals actually. And then I found myself thinking, that's all very well, but how do we quality assure that? What are the legal implications if things go wrong in that kind of digital exchange, if you like, of information, where somebody sits in a different country governed by a different set of rules and a different legal system. So your thinking in the course of your deliberations on this course about transparency of information, I'm inviting you to think more widely, not just about collecting little bits of data, publishing them on NHS Choices. I'm asking you to think about where that eventually leads. And I think it offers some very, very exciting opportunities for the way that we deliver care and share information in our NHS. Thanks very much.